Vertigo is a common condition that causes a false sense of spinning or movement. It can be a very disorienting and unpleasant experience. People with vertigo often describe it as feeling like the room is spinning, or like they are on a rocking boat. Vertigo is not a disease itself, but a symptom of an underlying condition. It can range in severity from a mild annoyance to a debilitating problem. Dizziness, nausea, and vomiting are common symptoms that accompany vertigo. Understanding the causes and treatment options for vertigo is essential for managing this condition. While there are medical treatments available, natural remedies can also provide relief. Vertigo can be caused by a variety of factors, most commonly affecting the inner ear. The inner ear plays a crucial role in maintaining balance. When the inner ear is not functioning properly, it can send incorrect signals to the brain, leading to vertigo. One of the most common causes of vertigo is benign paroxysmal positional vertigo, or BPPV. BPPV occurs when tiny calcium crystals in the inner ear become dislodged and interfere with the normal fluid movement. This disruption sends mixed messages to the brain, causing a spinning sensation. Other causes of vertigo include Meniere's disease, vestibular neuritis, and head injuries. Meniere's disease affects the fluid pressure in the inner ear, while vestibular neuritis is an inflammation of the vestibular nerve. Head injuries can also damage the inner ear or the brain, leading to vertigo. Identifying the underlying cause of vertigo is essential for determining the most effective treatment approach. While natural remedies can be helpful, it is important to consult with a healthcare professional for a proper diagnosis. The Epley maneuver is a safe and effective exercise for treating BPPV. It involves a series of head movements that help to reposition the dislodged calcium crystals in the inner ear. This maneuver can be performed by a healthcare professional or at home with proper instruction. To perform the Epley maneuver, you will need to sit on a bed with your head turned 45 degrees to the side of the affected ear. Next, lie down quickly on your back, keeping your head turned to the side. Hold this position for 30 seconds, then turn your head 90 degrees to the other side and hold for another 30 seconds. Finally, roll onto your side, keeping your head turned 45 degrees, and sit up. The Epley maneuver can be repeated several times a day until symptoms improve. It is important to perform this maneuver slowly and carefully to avoid injury. Ginger has long been recognized for its medicinal properties, particularly in relieving nausea. It contains compounds that can help to settle the stomach and reduce feelings of dizziness. Ginger can be consumed in various forms, including fresh ginger root, ginger tea, and ginger supplements. Studies have shown that ginger can be as effective as some prescription medications in reducing nausea and vomiting. It is believed that ginger works by blocking certain receptors in the brain that are responsible for triggering these symptoms. Ginger may also help to improve blood flow to the inner ear, which can alleviate vertigo. To prepare ginger tea, simply steep a few slices of fresh ginger root in hot water for 5 to 10 minutes. Ginger supplements are available in capsule or tablet form and should be taken as directed. While ginger is generally safe for consumption, it is important to note that high doses can cause heartburn or diarrhea. Section 5. Hydration and vertigo. The importance of fluids. Dehydration can worsen vertigo symptoms, as it affects the fluid balance in the body, including the inner ear. Staying properly hydrated is essential for maintaining overall health, and can help to reduce the frequency and severity of vertigo episodes. When dehydrated, the body's blood volume decreases, which can lead to low blood pressure and dizziness. This effect can be particularly problematic for individuals with inner ear disorders, as dehydration can exacerbate existing balance problems. To stay hydrated, it is recommended to drink plenty of water throughout the day. Other fluids, such as herbal teas and clear broths, can also contribute to daily fluid intake. Avoid sugary drinks and alcohol, as they can dehydrate the body. Section 6. Vitamin D. Can it really help with vertigo? Vitamin D plays a vital role in calcium absorption, which is essential for maintaining bone health. Recent studies have suggested a link between vitamin D deficiency and an increased risk of vertigo. While more research is needed, some experts believe that vitamin D supplementation may help to improve symptoms. Vitamin D is thought to play a role in regulating calcium levels in the inner ear, which is important for maintaining balance. Deficiencies in vitamin D may disrupt this balance and contribute to vertigo. However, it is important to note that vitamin D supplementation should not be considered a standalone treatment for vertigo. If you are concerned about your vitamin D levels, consult with your doctor to get tested. They can recommend the appropriate dosage of vitamin D supplementation based on your individual needs. Exposure to sunlight is also a natural way to boost vitamin D levels. Section 7. Stress management, reducing vertigo triggers. Stress can trigger or worsen vertigo symptoms in some individuals. When we are stressed, our bodies release hormones that can affect blood flow and muscle tension, potentially contributing to dizziness. Managing stress through relaxation techniques, exercise, and lifestyle changes can help to reduce vertigo episodes. Deep breathing exercises, meditation, and yoga are effective ways to calm the nervous system and alleviate stress. Regular physical activity has also been shown to reduce stress levels and improve overall well-being. Engaging in hobbies and spending time with loved ones can also provide stress relief. Identifying and avoiding personal triggers is crucial for managing stress-induced vertigo. Common triggers include caffeine, alcohol, nicotine, and lack of sleep. Making lifestyle changes to minimize exposure to these triggers can significantly improve symptoms. Section 8. Sleep hygiene, restoring balance through sleep. Sleep deprivation can exacerbate vertigo symptoms and make it more challenging for the body to recover from episodes. Establishing good sleep hygiene is essential for managing vertigo and promoting overall health. Creating a relaxing bedtime routine, maintaining a consistent sleep schedule, and ensuring a comfortable sleep environment can improve sleep quality. A relaxing bedtime routine might include activities such as taking a warm bath, reading a book, or listening to calming music. Avoiding screen time for at least an hour before bed is also beneficial, as the blue light emitted from electronic devices can interfere with sleep. Maintaining a consistent sleep schedule even on weekends helps to regulate the body's natural sleep-wake cycle. This consistency ensures adequate rest and can reduce the likelihood of vertigo episodes. A cool, dark, and quiet bedroom creates an ideal sleep environment. Section 9. Practical tips for managing vertigo. In addition to the natural remedies mentioned above, several practical tips can help manage vertigo in daily life. These tips focus on minimizing dizziness and improving safety during episodes. By incorporating these strategies, individuals with vertigo can regain a sense of control and reduce the impact of this condition. Avoid sudden movements, as these can trigger or worsen vertigo. Get up slowly from a lying or sitting position, allowing your body to adjust. Use assistive devices for balance and support, such as canes or walkers if needed, especially in unfamiliar or challenging environments. Maintain good lighting in your home to improve visibility and reduce the risk of falls. Avoid driving or operating machinery during vertigo episodes, as this can be dangerous. Inform family, friends, and colleagues about your condition so they can provide support when needed. Section 10. When to see a doctor, recognizing warning signs. While natural remedies can be helpful for managing vertigo, it is important to seek medical attention if your symptoms are severe, persistent, or accompanied by other concerning symptoms. Early diagnosis and treatment of underlying conditions are crucial for preventing complications. Consult with a healthcare professional if your vertigo is accompanied by hearing loss, ringing in the ears, double vision, weakness, numbness, or difficulty speaking. These symptoms could indicate a more serious condition that requires immediate medical attention. Additionally, seek medical attention if your vertigo is affecting your daily life, preventing you from participating in normal activities or causing significant distress. A healthcare professional can help determine the underlying cause of your vertigo and recommend the most appropriate treatment approach. Section 11. Conclusion. Taking control of your dizziness. Vertigo can be a disorienting and disruptive condition, but with the right approach, it can be effectively managed. Natural remedies, lifestyle modifications, and practical tips can provide relief and improve quality of life. Remember to consult with a healthcare professional for a proper diagnosis and to discuss the most appropriate treatment plan for your individual needs. By understanding the causes of vertigo, exploring natural remedies, and implementing practical strategies, you can take control of your dizziness and live a fuller, more balanced life. Don't let vertigo hold you back. Seek help, make positive changes, and reclaim your well-being.